Yeah. Yeah. Do you want some water?
Yeah, do you want to get some?
Sure.
I guess so.
What is that?
It's water.
That looks really contaminated.
Oh, really? I have been drinking since like 2 weeks ago.
Okay, that water is not good. I'll take you to the hospital right now.
Okay.
So what brings you into the doctor's office today?
I think I have cold, like I have the chill and pain and fevers. I think it's like the cold.
Okay, have you had anything weird to eat or drink or anything you
I
can think
have
of?
been drinking some water, but my friend says it's like contaminated.
Do you have the water with you?
Oh, yeah.
Yeah, I would say that's probably contaminated.
Really? Why? It looks normal.
No. Water's usually supposed to be clear,
Okay.
so I would definitely say that's contaminated. I would for sure say that you've probably ingested some type of microorganism from, where did you say you got this water from?
Oh, I don't know, from creep, I don't know.
Yeah, I would definitely say there was some type of feces or urine in the water. Yeah, probably. So I'm gonna try to get a hold of the doctor. We'll get her in here and we'll try to figure out what exactly is going on.
Am I dying?
I really can't say. It's too soon.
Let's have a look here. Okay, it says that you're a farmer and you deal with livestock, cattle,
Yeah.
right? Okay, and you drank this water and that's what you believe is causing your symptoms?
Yes. Yeah.
Okay. Do the animals also have access to that water? They drink out of that regularly?
Sure.
Okay, well, like you said, there is a possible chance that that water is contaminated. It really isn't clear like water is supposed to be.
Is that bad?
It probably is bad, but there are only, multitude of things that we could go through. It's all right. You'll probably be fine. It's probably nothing too severe.
Oh.
Okay. You also have a rash on your arm, right? Is that recently?
No, I just noticed.
Okay. Well, it could be good or bad, but it probably is another symptom. So we're just going to go proactive. We're going to take care of this right away. So the nurse is going to admit you, do some blood culture, either a urine test or a spinal tap fluid, and we're going to go consult with the other doctors and see what we can come up with.
These are flu-like symptoms. Why don't we just treat her for that?
Because when we admitted her, she also had a rash on her forearm. It could be a symptom of something more severe, not the flu. Maybe lupus.
It's not lupus. It's never lupus.
Do you have any other brilliant suggestions then, Dr. House?
Consider leptospirosis.
I mean, we could, but that's going to take at least a day to test for. And then within that time, she could develop any serious complications like hearing loss and extreme fatigue, cardiovascular problems.
So, start the trials. Start off on erythromycin 250.
That would also bind to the 50th subunit of the bacteria and inhibit its protein synthesis. It could work.
Going to get going?
Right.
Jersey Shore's on. Want to see if Snooki and Jay Wow actually hook up.
I finally got finished running those tests, and it did come back positive for Leptospira interrogans. That is a bacterial pathogen that will cause leptospirosis. So a good thing we started the treatment.
Rerun on Jersey Shore today. Decided to run to the lab. Didn't lyse the test. About 10 minutes. Came back positive for leptospirosis
While you
bacteria.
guys were gone, I did some more research. It turns out after our patient ingested the bacterium, it ended up in her bloodstream and traveled all the way down to her kidneys and liver. There, it was able to burrow into the tissue, and that's why it didn't cause any disease or pathological change in our patient. And that's why it was able to avoid her host's immune system so efficiently.
So what kind of damage will this do to her body?
Well, since in the kidney or liver, we can assume there would have been direct cell tissue damage because of toxins produced by the bacteria. But because we caught it so quickly and gave her treatment, we were able to avoid any serious complications.
Okay, so now that we've treated her, this will basically exit through urination.
Right? As soon as she finishes taking her medicine, it should flush right out of her system.
Well, let's go send her back to Old MacDonald's farm.
I can't believe we had to go and run that ELISA test. I was in the lab for hours trying to figure out this pathogen. At finally discovered this Leptospira interrogans, gram-negative, aerobic, rotational movement, with Amphitrachus flagella. It's a nice spider. He had to go and not even let me know. I had to use that silver stain underneath that microscope too. This is just really frustrating. Look, what I had to go through to find all this.
Well, it doesn't matter now. It's taken care of, so let's go and see our patient. We were right about the diagnosis. It is leptospirosis. So, as we've already started you on erythromycin, we just need you to finish taking your pills. You're going to take 3 a day for the next week or so until you've finished off every single one. We don't want you to miss a single pill. And when you go to work, obviously, you're going to have to make some sort of changes in your behavior. Like, for instance, no more drinking dirty water. Definitely not. And if you're going to be waiting in that area where the animals are drinking out of and going to the bathroom, then you're going to have to make sure that you have something to cover up all of your skin. Wear like heavy boots and gloves, and if you have a cut, make sure that's covered up really well so you don't have anything getting in there. And if there's other people at work, advise them to do the same. But other than that, you should be fine.
Oh, I'm so relieved.